So today we'll be doing our HDC. So first off, I'm gonna knock to the patient's room, knock knock. I'm gonna apply hand hygiene and hi, my name is Neil. I'll be your nurse for today, and I'm gonna be the one who's gonna administer your HDC and sub-Q port. So first off, HDC is pretty much um, a medication solution that is being administered to patients who are hydrated. So after that, I provide privacy for my patient and raise the bed to my working height position and then side roll down. And before I even do my two identifiers, I'm gonna apply some hand hygiene, and I'm gonna ask for the patient's name and date of birth. So what is your name? Mr. Square. Okay, good. So Mr. Square, what's your date of birth? April 19, 1940. Okay. So now that I have done my two identifiers, I'll be moving on to my allergies. So Mr. Square, are you allergic to any medication, animals, environment, latex, and any of that? If so, what are your reaction? No, I'm not allergic to anything. Okay, good. So now I'll be moving on to my pre-assessment, which includes of vital signs and pain assessment. So vital signs consist of I'll be taking his pulse rate, his blood pressure, his respiration, his O2 sat, and temperature. And as for pain, and I'm assessing for pain for OPQ or STUV. Even though he doesn't feel any pain, I'd still assess for pain. And after doing my initial assessment, I'll be moving on to my skin assessment. Um, so with the skin assessment, I'm inspecting for any bumps, lumps, lesions, and redness on the skin or um, masses or tenderness. And also, I'm also testing their skin turgor. So by doing that, you'd have to pinch their skin above their clavicle, and the skin should return promptly once released. Now that I've finished my skin assessment, I'll be telling Mrs. Square that I'll be right back to get everything that I need for this assessment. So Mrs. Square, I'll be right back and get everything that I need for us to proceed. If you need anything else, or if you change your mind, or if you have any questions, just press the call bell into your right side, and any nurse will come and provide, and any nurse will come to you and help you. Now I'll be lowering the bed in the lowest position and then side roll up to prevent a fall. And I'm also providing the privacy on for Mrs. Square. Mrs. Square, I'll be right back. So now that I have left the patient's room, I'm on the med card. So first I'm gonna wash my hands. So I'll be preparing my I'll be getting my equipment. So let's say I already got my equipment on a tray. This is a tray, and the reason they're on a tray is because I don't want them to be on the table because they're gonna get contaminated. So first off, we got a 1 ml syringe with a blunt fill needle, a butterfly needle, a neutral connector, a normal saline or a sodium chloride, and an alcohol swab. So before I even start checking my equipment if there's any damage or anything like that, and I'm also applying alcohol swab on all of these to prevent contamination. And now I will begin. So first off, I'm gonna open my blunt fill needle. So here's my blunt fill needle on the package. First off, I'm gonna take off the cup that is sealed on the end of the blunt fill needle, but I'm making sure I'm not touching the inside end because that's gonna contaminate it. So let's just pretend I took it off, and then I'd get my alcohol swab and then apply alcohol swab on it and clean it thoroughly. And then I put my butterfly needle on my package, not on the table, and I'd get my neutral connector. So I'm gonna take this one off, and then I'm gonna clean the end. And as I clean the end, I'm gonna connect both of these two and then put them in the package, not on the table. Okay. Now that I've done that, we have here is our normal saline. So first off, before I even extract some contents here, I'd have to apply alcohol swab on the top where the injection's gonna go. Once I've done that, I'm gonna open my 1 milliliter syringe. But first off, I forgot, I have to prime my neutral connector and my butterfly needle. So I have to prime both of these. So the butterfly needle has 0.29 millimeters, and as for the neutral connector, it has 0.25 millimeters. So I'm gonna add those two, and we will have a 0.54 millimeters, and there's gonna be 0.54 millimeters on this syringe. So first off, I'm gonna extract some contents. By doing this, I'm doing the sideway technique to open this. I'm gonna put this in here. I'm just gonna hold it because I'm doing this on the bed. Now that I've inserted it, I'm gonna pull this up. Okay. I'm making sure that I'm not touching the plunger because it's gonna cross-contaminate it. Okay. Now that I've done that, if there's any air bubbles in here, carefully flick it like that until it goes up, and then take the remaining off, and then take the remaining off on the sharps container. Okay, good. So here I'm gonna do the scoop technique. I'm gonna twist this cup off, and then we won't be needing this needle, so this blunt needle, so we're gonna twist it off and remove it, put it here, and we're gonna put this on, then we're gonna put this and connect it to the neutral connector. Okay, and then as I do that, I'm gonna prime it to 0.54. So I got 0.54 here. Now that I have got everything ready, I'd be putting everything that I need on the sharps container. I'm gonna put everything that I don't need on the sharps container. So now I'll be entering the patient's room. Knock knock. And then, hi, Mr. Square, I am back, and I'm gonna apply some hand hygiene, and then raise the bed on my working height position, and then side rail down on my working side, and then I'm gonna do my identifiers, my two identifiers again, comparing it with the armband name and date of birth, and then I'm gonna tell Mr. Square that I will before I even administer this medication, I'm gonna teach him about it, tell him the effects, what not to do and to do, and also right to refuse if all of this is okay with him. And then after I do that, I'm gonna administer it to my patient. So first off, sorry, I forgot that I will have to take this off. So just this off. So let's pretend this is the patient's skin, and I'll be inserting this to his abdomen. So the way that I do this is I'm gonna apply some hand hygiene and apply gloves, and I'm gonna take this needle right here and I'm gonna do the butterfly technique. So just like that, and I'm gonna do a 40-degree angle onto his skin, pinching the skin as I insert it and then releasing it carefully. And then I'm gonna coil this one, make a coil, and I'm gonna tape it. And then with the tape, I also have his I will I will now label it. So with the date that is being administered, my initial time, the set concentration of it. There we go. Okay, now that I've done that, I have here in my bag, I have pre-primed my HTC. So doctor's order is at 50 millimeters. So, and then here we have 10 drops millimeters. So what to do is 50 millimeters divided by 6. So we got 8 drops per minute, but I'm gonna count 2 drops for 15 seconds. But first off, we're gonna check if we have the right solution. So we're gonna compare it with the physician's order to make sure that we have the right one. And then we're making sure it's not touching the ground. And make sure there's a label on it, the patient label, to make sure that it's the right one. And then we're also checking if this is close and making sure there's no leakage on it, any of that stuff. I will now count. Okay, now that I have got my desired drop rate, I'm also making sure that there is no big air bubbles or leakage in the IV fluid. If there is, just like flick it like that or flush it. Now I will be connecting this to my butterfly needle. It's here. I'm also making sure that this tip is clean. I'm applying alcohol swab on it, and then I connect it here. There, just like that. And then once I've done that, I'm gonna tell Mr. Square that I will be right back, and I'll be doing his evaluation and post assessment, and I'm gonna recheck on how he feels, and also I'm checking the needle if there's any blood return on it. If there is, I have to redo everything with entirely new supplies, and then should be it. And then I would go out to chart and document and that's it.